Today is carrying on the talk on women's health. But we're going to cover some of the research on that. You can look it up yourself. It's not really difficult. But when you look at research, just some key principles. You want to avoid using any search engine because you'll get all studies, small, big, large. And look, I'm very enthusiastic. I do a study. I might find an effect just because I'm enthusiastic. It may not actually mean anything. Individual case reports, be very careful. They don't mean a lot. So the one you look at is something called a randomized controlled trial, which is basically you have two groups. Both could have been getting the same treatment, but randomly one gets it, one doesn't. So there's no selection bias. And then you see the benefit, right? Otherwise, these studies are notoriously hard to believe. So what evidence-based means that you've got evidence that is objective. So if another person, another country does the same study with a group of patients and does the same thing, they should get the same result, right? You're not the reason why. Some of the reason why is because what you did was different. So scientifically, as physicians, very rigorous. We have to be rigorous before we apply things. So the data I want to present is evidence is randomized trials. So there are many, many studies there, but you can't you can't say they're true, right? This you can say is close to truth. All right, so why are we doing women's health? Why exploring? Well, as we already heard, it's common. There are a lot of issues with women's health that we touched on. Just to give an idea of how common it is, in one of the surveys, 75% of women at work experience health problems that will be categorized as women's health, with some broad categorization. And sadly, 34% don't feel that their issues are really taken seriously. So it's a gap, big gap. And so that is something that we are obviously addressing. So how does yoga work? Why would it work? Why would you even think of yoga? Well, we know that yoga has neuroendocrine mechanisms. We touched on it before. We did all the vagal nerve and the brain. We did all of those things before to understand this, that there's definitely a pathway how yoga can affect you. There have been studies in the past with yoga in the polycystic ovary syndrome, and because of how they become more androgenic, it means their hormones are more man-like, let's say, or more aggressive, and the metabolic pathways have changed to more diabetes. So there have been changes there they've seen with yoga. Yoga has been also tried for primary dysmenorrhea. That's where they have pain. So we'll review this. Yoga in menopause, yoga in prolapse, this prenatal mindfulness. It's interesting, the prenatal mindfulness, which we'll touch on. And then some studies on yoga where somebody has breast cancer and surviving, how it seems to help them. Okay, so we'll talk about those. But we know the importance. Of course, many of you know that, but it's important that we mention it's a very important area. So some of the asanas they've used in studies, I won't mention them each time, but just review some of the ones that generally have used. And then watch all of them. We're going to go over it tomorrow with Rameshji. So we're going to do watch all of them, if not all of them. So in the studies, they've used the Bhujangasana, they've used the Madhyasana, the cat pose, Matsyasana, Pada Konasana, Balasana, then liberation of sun salutations, and pranayama, which some of you go over. They have deep breathing techniques, which the Nadi Shodhan is another one. Kapalabhati is another one they've used in women's health settings, and relaxation like Yoga Nidra has been used a lot. And these are ones you're familiar with mostly. I just put a picture there. So this is one particular group uses these as their therapies for women's health. So one of the clinics uses these. Okay, so these right up, don't worry, it's just pictures there and what they have. So when I talk about the studies, they generally use some of these so that we don't have to keep repeating that. So generally you'll understand what kind of poses they may have used in their study. Okay. So the neuroendocrine mechanism, that is where your brain and your hormone system communicate, and how yoga can help and how they can help some of these disorders. Because clearly they are engaged with your organ, but also your endocrine system. Right? A lot of women's health are to do with the endocrine system affecting your organ, like your thyroid, but also your progesterone, all the hormones you make. So very much linked to that. And how do the nerves and the hormones, how can we use that, knowing what we know about yoga, and how do we use that to benefit? So you can almost figure out what to do, right? It's very nice. So this is the classic axis we talked about before. You have in your pituitary, you release this hormones, CRHs. We've looked at this before. And then ACTH particularly goes to your adrenal gland and releases cortisol. Cortisol is called a stress hormone, right? It's when people say stress hormone, cortisol. And that's at some level you need it when you're fighting or running away from a fearful animal, but otherwise it can cause its own damage. So these are the hormones, and the others like that affect your women's health and organs, the ovaries. They can affect other areas like that also. So we know that we have yoga can affect that. We've studied that before. We've seen some of the presentations before. So we could make sense, right? So it can make sense to apply it here, pick the right ones. We should be able to control that. Then biologically, we do know that it's a physiological process. There's things happening, hormones releasing, the nerves are getting there. So if I do things in that area to calm it down, it makes sense. And then we also know that this axis we can affect, right? We know the signals, the chemicals, all the studies have been done. And we'll talk more and more with different studies, but we know all these numbers go down with yoga. We know when they go down, how far they go down, which poses seem to do well. And the messages that your cells get from your changes in nerves, we studied that. One of the studies that we did with Samriji, for example, which is very impressive, which we'll go over one day also. So studies, we know that's working. So we have true like pathway and mechanism and step by step, right down to the door and the room and the carpet and the small fibers and how there's, with all of that level of detail we know that yoga can do. All right, so this is your axis again. So what's it? So it's a cortisol steal mechanism. What is that? Well, when my sympathetic axis, right? You know the Ida and Pingla we talked about. The sympathetic is the one that is on the right side, that's more aggressive and fighting. And so when that is firing, it keeps firing as it does in diseases, right? You are going to drain your system to make more cortisol. Cortisol is in the adrenal gland here. Then you're dragging your things away from what you need to make. So it's a stealing it from what we need. So this HPG or HPO axis is what you need to work properly for your ovaries and your estrogens and progesterone, things that we know are going to help you. But when you stressed, this pulls it this way. All the work's going this way. So you're not getting enough. And remember, we heard how some of these medicines work, because what's happening is we're pulling the whole thing this way, so you don't have enough, right? So you can imagine, because we already know, right? We already know how sympathetic drive, right, can be cut back by yoga and meditation, pranayama and mudras. We know that, we've learned that already. So you can imagine if I work on that and increase this, I know I can help. So you can already make a conclusion that this is an ideal area to work on because I can control these things, the same things we talked about before. And then I can improve this balance, and therefore it'll control it better, work better, and have ability to kind of calm things down. So you kind of see how it all fits, all the lectures before, all fits now. It all makes sense. You should be able to figure out just by this. And then we know that the vagal tone, right? This is a vagal tone issue. Remember the vagus, we talked about the nerve that controls and goes to the whole GI tract from the brain. We know yoga and meditation, particularly the pranayama, can control that, right? So now we know we have something we can master and train and teach and should do really well. This is one of these ideal places where this should work. So again, we're more confident that this mechanism makes sense. All right, so if you remember, this is a polycystic ovary. See how the cyst? This is what it looks like. They make cysts and they collect fluid and inflammation and other agents in there, and it's not working. That's because of the pathway to have less of the hormones that keep it under control. They're deranged. So this happens, and then it causes a lot of problems like hair. You got hair, mustaches, and acne and things that we heard about from Vaishali. Very unpleasant pain, and also, as we heard, it can affect your temperament. But it's treatable, right? So it's treatable and it's a condition. So studies have been done to show it actually works well. There's a study by Nidhi in about 2012, which shows that it reduces a hormone which drives the cyst called anti-Mullerian hormone. And the LH and testosterone levels are controlled also, which are what would bring you back to more normal. It then starts restoring a menstrual cycle. They've shown that improves this hair and the acne that I just talked about. And also it then, because the cortisol is under control, you're damaging your DNA less. DNA is in every cell that the nucleus has that determines proteins you make, how healthy your cells are, how you breathe, how you work. DNA is kind of our brain, if you like, it lives in our brain in every cell. If that is stressed, then it makes mistakes, errors, you get sick, other diseases, chronic diseases, and even, in some cases, cancer. So these are things that you want to control. And so you can see how when you do this yoga and meditation, the ones we talked about earlier, and some combination over 12 weeks, then you will see benefit. They compared one group with yoga, one group with exercise, but it was random. They kind of, if number one went there, number two went there, number six went there, they did randomly. So the person then got allocated. They didn't choose, and the person didn't choose by a computer or a list. So they were not biased. They were like randomly. So anything you see would be real. That's the idea. Okay. If I pick one other, I like them, don't like them, or whatever, and then I'll make the results abnormal unwittingly. And it can happen without you knowing. So that's why we do it like this. All right. Then another study, and this is a handout for one of the PCOS. They did a 12-week program in 2023, and they had 25th part. So again, not a big size, but they found a 12-week yoga protocol led to reduction in the hormones and the negative aspects of having PCOS. Then another a group looked at all the studies before 2023 of 11 studies, and they found in all the studies together 515 participants, and they found decreased menstrual irregularity and the hyperhormone, the androgens are the male kind of hormones that reduce significantly. And so, these are very powerful techniques without drugs. You can imagine how powerful these are. And then another study in 2025 found a 12-week yoga, another showed increase in mitochondrial DNA copy, which means that your engines of your cells are restored and able to deal with the stress. When you get a lot of stress, the DNA copies drop because they're overused, and this restored that. So it tells you even at the level of your fuel cells in your normal cells that is improving, not just feeling better. It's actually all the way right down to the nitty-gritty of the hair and the carpet, right? So it's quite profound. So the studies have been quite good. So that's your PCOS, and we talked about that's pretty common. Next is yoga for primary dysmenorrhea. This is where they have your periods, but they're extremely painful, right? These are painful, and there are many terms for this, but this is one term. And those days can be quite hellish. All right. So then what did that they found? Well, similarly, there was a pretty good study it's called the Cobra-Cat-Fish study, in a way, protocol. In this particular one, they randomized patients to get a regular treatment and yoga, regular treatment and yoga. The yoga poses they particularly used was these three. All these you're familiar with. And they performed 20 minutes a day for 14 days in the phase. And remember the luteal phase? This is the phase. It doesn't look clearly. It's the orange. Then you get menstruation. Then you have your follicles growing in the ovaries. And then you ovulate. Then you go to this rest phase. You come back again. So you have to pick, in this particular study, they picked this up for reasons that make sense, right? The luteal phase, and they did it 14 days for 20 minutes for 2 months. Okay? And they found that in the group that they didn't do this, 7 out of 10 pain, if you like, 7 out of 10 had ongoing pain, whereas the group that they did this only 3 out of 10. So that would be a good effect. Okay, again, I warn you, nothing's 100%. Nothing's ever 100%. Even the best medicines we have only work 70% of the time. Some, if you're lucky, 75% of the time. That's why we have to swap medicines, change. Lots of reasons for that, but very rarely anything works 100%. Very, very rare. Maybe insulin's exception, but it was very rare. All right. So they use the Cobra, cat, and fish. It's a good combination. And again, effective, good study, randomized. So, and then the other studies looked at menopause. So menopause, as we know, can occur from a range of premenopause and menopause. We heard about that from the mid-40s up to the 50s or later. And with that associated many symptoms. Could be nothing, but otherwise have brain fog, hot flushes, anxiety, depression, fatigue, heart rate irregularity, mood swings, and the person can't control it, right? It's a system inside. It's not them causing it. And the nails get brittle, they get bloating, joint pains, loss of libido, periods irregular, vaginal dryness we talked about, dry and itchy skin, right? They get this tingling sensation like someone said burning, and they'll report that, right? So it can do a whole bunch of things that we know and very, very common, okay? So what do they do here? What do the studies show? Again, so very early, the earliest studies with the randomized control trial, which is often referred to, they found various menopause symptoms we talked about improved. They had 200 women, and they again randomized them. And they looked at these hot flashes, night sweats, different sleeping, emotional changes, dryness, and quite a few of those improved. Another study, which is part of a national study, MS Flash, this is a large design, so it's a very, very reliable study, the way they designed it, big sample size. And they compared yoga and exercise and usual activity. And it found the hot flash seemed to improve in all because of tension, so it probably was more effective in a study. But they did see other reductions. They did see differences in other aspects, and so it can help in some of the aspects, but mostly all aspects. Another study in 2024 found that 60 minutes of yoga, similar things that we talked about for 10 weeks, reduce psychological, the stress and the, if you like, the mood symptoms, and also the local vaginal dryness symptoms compared to control. So clearly beneficial. It sort of makes sense, because of what we talked about. Then further studies showed that it improved menopausal symptoms and sleep quality in the perimenopausal phase as well. So you can start early. As Vaishali mentioned, some things you start early. You don't wait till you get there. You just work on it early and maybe prevent it. Swain et al. In 2021 found yoga causes quality of life, and the hormonal changes that we mentioned were improved. And another study with Shivam yoga, they found hot flashes did improve and insomnia over about a 2 year. So the longer you do it, you start seeing other benefits. So important about this is a 2-year period. So you start seeing some benefits that wouldn't appear just after a month. And the estrogen level went up, which is usually beneficial and slowly gets you out of menopause. And in 2016, another trial using Hatha yoga, they found the stress depression improve. Again, it's 12 weeks, but long enough, and they've sessions with 75 minutes twice weekly, so not even daily, and they found improvement. So lots of things here that we can incorporate, which are good studies where we can rely on the fact that we see a similar response if we try it ourselves. Okay. And the MS Flash is a big one. And as I mentioned, it showed no significant difference in the, the runny nose and flushing the face. They didn't see that. Some of the other yogas did, but they did show improvement in sleeping severity and insomnia, sleep, and which is a very important part, and reduction in depression, anxiety in yoga more than the other groups. So this study has really embellished the importance of this, incorporate into your routine of care and add it to your care. All right. But next, we'll go to yoga in pelvic organ prolapse. We remember this is a very shy slide. We have no prolapse here. And then here we'll get the bladder prolapsing. That is the yellow, and sometimes the uterus, and sometimes the rectum, and then sometimes uterus. So all of these occur for various reasons, as you mentioned, age, babies, could be even without babies, can happen before, as you mentioned. So could be tissue laxity. But again, another consequence is quite embarrassing. So this is another area. And this is where we talked about the Kegel exercise. And yesterday this came up, and I think somebody, good question, are we going to get taught that? Well, let me tell you what it is, and you'll see what it is. So really, it is this on the left. You lie down, put your arms down, and you lift your bottom. Does it all make sense? Does it look familiar? And then you try to repeat it 10 times, and that's a set. Then they do one set in the morning, one set at night. And then as you gain strength, you increase its numbers, hold, and then relax for 5 seconds, for example. So that is exactly what Setu Bandhasana is. So when I looked it up, Dr. Kegel had, nobody knows they ever met a yoga. It was in the 40s, late 40s. Of course, yoga was known. So we have to assume that he came up with this himself, but it's very, very remarkable how it is close to what we do. Interestingly, or more so, when you're in a car or sitting and you want to do this, as we actually mentioned, the Kegel, let's see what this is. You identify this by trying to stop your urine midstream. Peeing and you try and hold your urine because you sort of stop, right? That's a pelvic floor exercise, right? You sit upright in a seat, forward to the front a little bit so your spine is straight, which makes sense. You gently squeeze and hold in these muscles, and you try and hold for 3 to 10 seconds. Then fully release the muscles and count for a similar amount of time, and do 10 repetitions, aiming for 3 sets daily. And this is trying to work. It works in more than 80-90% of people if you do this. Well, guess what? Mula Bandha is exactly that. Root lock is exactly that, and probably we'll go tomorrow. So clearly, in yoga, this has been used. It's just a term is not used what for, not for this problem. So we can't take credit for that, but clearly it's the same thing. And you give credit to him. He figured it out from other ways. So I think it may be that he did figure it out. Okay, there's Kegel. So, and what's the data? Well, the data is pretty good. The data for this is pretty good. It's at 90%. So we don't have to worry about efficacy because the study's been done on that in a very, very proper way, and it works really well. This is something we added on just because it's interesting. We wonder what we can do with women, what's safe. If somebody asks you. So there are studies, and you can limit to what the studies did, then it's safe. I wouldn't do anything more or differently to what the studies have done, just because of the high sort of risk. So prenatal mindfulness and infant neurodevelopment. So in this particular study, they look at, this is in Florida. They looked at pregnancy-related interventions. They used mindfulness, a little bit like Kaiser, or at least some of the visualizations. And when they did it in women during pregnancy, what was interesting is they found that the infant stress response during pregnancy was improving at that time. Means it controlled the flow and the stress the infant felt. And then they followed them and they found that the recovery from any issue, the baby bounced back faster. Cold, a thermometer, they bounce back faster. And they found that at 6 months, they also saw evidence that their mental health was better based on a study, a question that they could do or assessment they do. And they measured the cortisol and found that the maternal cortisol, the stress hormone, the baddie that we talked about, influence of fetal development, and this was lower. So you can see how less stressed message went to the baby. So the baby's less stressed, so they learned less stress. They're more stable. So when they grow up more stable without having that injury and the memory of stress, and therefore always getting stressed. Right. So it looks like very good. So it affected the same sympathetic pathway system we talked about when we did yoga, the vagal. Same thing happened when the mother did it and helped the baby. So it's fascinating. So this is probably the few things you could mention. There are some, we don't want to cover it fully because we didn't want to touch on that in this particular 200-hour thing, but there are one or two others that are safe in pregnancy, but we're not doing that in this particular program. Okay, and yoga in oncology and breast cancer survivorship. So very common in women, obviously. So they found, ours has found that fatigue is less. Fatigue reduces the percent fatigue, and doing chemotherapy particularly, they find that the duration and the timing and sort of fatigue is shorter. Control study with RCT. The sleep disturbances, both what they're feeling, but also when you do a study and measure it, shows better. So, and one large trial showed that. So it's a true finding. You can probably say to your you'll probably benefit from that. Their quality of life, it boosted that, which meant the emotional functioning, social functioning. And this, after the 2-3 month course, benefited for months after intervention. It's sustained. So you became a more stable person. You stayed like when they stopped, the benefit lasted several months. So that it's a powerful boost. The physical function, like the from radiotherapy, the side effects, all those they showed evidence, different studies to improve. And then nausea and vomiting, which of course acute symptoms, short term, but if you already train them and they know yoga, if you apply that, their symptoms for the same reason will improve. Some of the things they use is neck stretches, neck rotations, shoulder rolls, all the things we do, as well as yoga. So it's nothing specific that we don't do. And based on ability, the responses are quite good. And this paper is available, and we can sometimes even, if you have a patient, go back to the article and say, what do they do? Maybe I'll mimic that. No reason why I should not. We've been trained those poses. Very good. All right. Now, in one of the studies, they actually looked, what I like is even down to the level of markers, not just I felt good, but did I actually change at the cell level? And they found in one study that, yes, they found the IL-6 inflammatory marker the body uses commonly to inflame, decreased by 15%. So that's medicine will do about the same level. You take a medicine every day. Imagine the power of this. And the Iyengar program, which is what you've sent by Bina Ben recently, the books, focus on health being, and they found this is what they used, and the improvement was multidimensional, we mentioned. So it's a pretty powerful thing. And some of the other poses they did are here, okay? Above the ones we mentioned above in the beginning. Good. So we're at the end. So what are the takeaways? Well, clearly PCOS and active yoga, good data, you can use it, right? And top medicine is not, we're not going to take the other therapies, remember, they're complementary, but you can definitely advocate for that because there's data and you can say, look, really good data. Pain we talked about, and dysmenorrhea, so we definitely have good data there and why it would work, and what their time investing in it. Menopause, again, we found good studies that have been very robustly done. Prenatal development, if somebody's interested, that's a good one, an important one, because it certainly seems to work. Because music works, singing works, but in the study, they looked at this, right? And then the oncology and intervention, there are lots more data on that. In fact, it's offered in many hospitals. It's almost common now to see integrative medicine. When you go to any oncology unit, they'll offer that. In fact, now there are physicians just training this in these hospitals who provide that part of therapy. And they, amongst other things, yoga is one they use. So this is part of regular care now. All decent hospitals with oncology will have these programs. You just ask for them, or they should offer it. Okay. All righty. Hopefully there's time for questions. Good. Any questions?
No, that was actually really good. I mean, I didn't even know that so many studies had been done on yoga and just women's health. It's amazing to find out about. I mean, just like the Kegels, like so long ago he was doing it, and it's exactly what we are doing now. Not now, but talking about it now.
To be fair to him, the Kegel that he wrote about was slightly more involved, so I think he did come up with it. It actually had a little device and a pressure feedback, and when you do it, you get feedback loop. There's a
Okay, wow.
device in your area.
Right.
So he did like that, and he'd give feedback, and the feedback is what helped to get better and better.
Ah,
But
okay.
these are the poses that helped him get there. But he then have a device in that area and a muscle.
Right.
And as you did it, he'll tell you you're doing better, keep doing it, what to
Yeah, it's
focus
a bit
on.
like your ADL study thing
Same
with
biofeedback. So he did a good job,
biofeedback.
and he
Yeah.
opened this up.
But it's just incredible. It's really good.
No. I looked at a paper, original paper, dig it up, his pictures. It's really quite an interesting story. And I'll tell you what he did. He kept his device cheap at like $39, which is a good thing, right? You think it's a good thing. It's a good thing because people can afford it. The problem is that no business would make money out of it. So when he passed away, he died because if we charge more, which
it's
I
so
don't want
cheap.
to, a
Yeah,
company would
yeah.
have taken it up like Medtronics, and they would have then marketed, people would have had it. But
Yes.
and after he passed, his wife ran it for a couple of years and she gave up. So so it's a good story, but sometimes cheap is good. But this is America, right? You have to make it
And
business
America
viable.
can never be cheap.
You make it business viable. So anyway,
Yeah.
that's a side
Yeah.
story. But good. Maybe we should charge more for a yoga course because we're making it too cheap. All right. Any other questions?
So I think in the past experience, yoga has been very much helpful during pregnancy, menopause, and even the teenagers having menstrual problems. So like this bridge pose, butterfly, so many poses help during this for the pelvic mobility that help the flow of blood circulation, ease the pain. So there are tremendous good results out of it. So it was really a good session having sharing with yoga with these issues. So I don't know, like people here in menopause, like a lot of people go with hormonal replacement drug therapy. So I mean, I don't know how that works because in this country, you know how it is. So there are side effects or how that works. I really was curious to know.
They work. To be honest, I wouldn't. They do work. They work well. Sometimes it's an option, right? Do I want to put up with the symptoms or take the medicine? And some people that are working maybe have no choice. So I wouldn't discourage them for. But I do think that we can offer this as adjunct, and then they can lower the dose and they can decide. But the treatments are safe. There are always some issues. We have taken every day. To basically, you take the medicine which I talked about yesterday. You have to take those medicines. They work. They might get you over a hump. And but it's important to recognize it's a true disorder and it affects the outcome, affects the functioning. So you should be empathic for them to seek advice and get therapy, not try and fight it. Because if it's that often, that much every day, and they're usually at that time top of their life, the kids, the family, they have lots of tasks. It's not a time for them to be sick every day. It's just not. The system doesn't work well when you're sick and you're central to the household. So generally, people don't go, but maybe they should, is really what it is. People should seek help, but they don't. So we should be in a position to recommend, look, we can help you, but you should get help because this is not something you can poo-poo or disregard. It's a serious, significant, and if men had this, they'll get treatment. don't put up with it. So you should do the same. I think we have this agenda that has been long-term, but we kind of ignore it's expected. They do it all the time. Who cares? Their periods, they're, miserable for a few days. Well, that's not necessarily right. I think it should be more empathic. Well, affecting the outcome, affect their performance, then they should seek help. And the help is very well done by the doctors. They do a good job. So I wouldn't say it's bad or dangerous. No, I think it's the opposite. Encourage them to get help and choose what they want, but not be fearful. Not be fearful. They're very simple medicines. They're not dangerous.
Okay. Thank you.
Devendra Bhai, I'm sure just like Beena Ben said, there are many, many undocumented benefits of yoga helping with these conditions. But you highlighted some of the more scientific studies. I was wondering if there are data available from these studies to highlight. We know that these studies were done and some of these yielded significant, statistically significant results. But it would be, I think, more convincing to anyone to see the data, actual data, in a graph form or anything, would that be available?
I have it. I didn't submit it because sometimes for some people it's a bit too coarse. I kept it simple on purpose, but of course I reviewed that data. I looked at it, looked at tables. But some of them are, unless you know what you're looking at, like you do.
Yeah, like
in
a simple form, like a 2 bars comparing the control group versus the yoga group, and seeing a reduction in this particular condition or effect on this particular hormone, which helps with pain relief, for example, or other things.
Yes. And I can say to you, and to your point, what happens is because it's a very complex plots they show. And I a couple, but it took me 20 minutes to explain the plot. Just one of those. Because what they do is they will look at, like the forest plot. And those are really, it will take me 10 minutes to even teach you them. So on purpose, I didn't show it. I typically do. But to your point, yes, they exist. And rather than that, because so many studies, it's almost clinching that like this is not just one person, different countries, different people. So I think that the reason I put all those studies is show this everywhere is found, different people. Now, most of the studies, they have a really good yoga person devices too. So I'm not worried about that. The quality of yoga is awesome. They train really well, Iyengar yoga, so the teachers have been very well picked who are deep teachers.
I was just wondering, when we are discussing benefits of any particular asana, for example, maybe we can include this as a very convincing evidence. Yeah, there is a scientific, study done, and here is the result.
Yes. And we can do that. I like that because I think at the end you need to get like brochures in your mind. We create that have evidence in them, highlighted with the studies with the image, like a drug rep. Right. No, I think that's a good idea. That might be a project.
Because we believe only with these are the benefits. It does reduce this, but if you have a data accompanying some of these,
correct,
very convincing.
Yeah, we can do info cards. Like the when we have drug reps.
2 examples. Yeah,
correct. When the drugs, that's all they do. They can't do this detail. They'll show you one plot, them online, new pictures, but they're correct.
Right. And with the reference indicated under,
I think that's a great, maybe somebody's project was somebody asked, this could be a good project for somebody to do.
Some of the poses that we are learning.
And we can share it, right? Maybe it's my project to do as my Samiji's thing. I love it. That's such a good idea. We can market it better. I like that. Good suggestion. Really good. I think I'll take that up. I like it.
There are so many evidence, not only in this issue for women, but for even heart problems, anxiety. Yoga has been tremendous results, having effects on people's life. And so nowadays it's getting more popular, and people are, more depend on yoga nowadays, even the Western world. So I'm glad that we are offering these classes to be aware of it, for the disease problems. So, I mean, we can do like a whole format, you know, with various diseases. And I know you had in the past project with the kids also, right? With the ADHD, like anxiety and everything. So many results are there in many ways.
Yes, I think we're going to be talking about all those researches, and when we talk about the different conditions, Dermot is going to present the researches done for each of them. So it's going to come up. And I think at the end, we could do this, exactly what you're saying, make a little brochure kind of thing, showing small little details, enough to convince the people. This is a very
like
unique
for example, we
Not
talk
just
about camel pose, how it helps the thyroid gland for the women's, or you know, so these all have direct effects with the poses, or once we practice, and then mudras, then pranayam, that relaxes more a deeper level. So you go step by step with all this process. So I just wanted to share, nothing else.
Yeah, that's awesome.
No, this is, and Tabina, I think what you're saying is what drove us to do this as much as, you know, because I think the tools are there, and if we train people, they can apply them, right? So I think that we are basically, like with the plot I showed you about the axis and the vagal nerve and the sympathetic, the parasympathetic, they all know that, right? Whoever we get, they already know that. They're going to figure it out themselves what's working. See, the level they're at, they could have probably predicted which pose would work, and there'd be 90%. That's what I want to get to, is that they have the background, the nuts and bolts. They can themselves figure out, hey, this might work in this situation, because each situation can be so different. And so they have that inner wisdom that, oh, this area works in this pathway and it affects this cell, its oxidation. And so maybe I can add this to this person as opposed to that. So we can customize. And so I think, and to your point, we'll review those studies, and I'll take the recommendations to heart to make them more visually, you know, like, so we can then get feedback and make that become a brochure later.
Like for example, I can give a very good example about alternate breathing, Anulovilom. Just look at it, that we are balancing both sides of the brain because we are doing alternate breathing. It's a direct effect. For example, this is just an example. And that relaxes your vagus nerve when your mental anxiety, because your one side is spiritual, one side is logic mind. So alternate breathing is, for example, if you do like 10 minutes long practice, you can see the brain, all those neurons working and calming down. But this is all matter of practice and how you do. Definitely, that's the most important thing. So as I said, this all has direct logic. When you do something, that's why you want to really feel it when you do it, so you know exactly what poses or what pranayam is affecting in your system, and that's how you get a holistic healing through that path, basically.
Yes, Samriji, I think we're ready for you.
So that is very good discussion among all our, what to say, yoga teachers, trainers, doctors, and participants. Yes. So this is a good topic for doctors to discuss more. So it would be better if Dr. Devendra can present the new studies, as Rakesh was telling, tomorrow. So you can take tomorrow's topic session.
Samriji, I think we should probably finish the package to learn the thing, if it's okay, because I'm going to present that feature studies. I've got lots of research for all the other diseases, so I'll cover that then. I've got after every illness, I have all of them, I have this data for there. So what he's mentioning is a formatting, so we can make it into a flyer to use, which that'll take time to create. So I'll recreate the plots and make it so that we can become like a page, like a flyer. So it's more like a marketing tool. So I think that's a good idea. That won't happen overnight. It'll take me a time to develop that. But I think we should probably finish this package. It'll be out of sync if you get the mudras, because then the next day we're going to do the yoga, and then the whole mudras and yoga thing Ramesh will put together, and that'll become their package for women's health. So if we do that, then, and he does his, we'll then put it all together and then he compiles it. Last time for the sleep, I sent it to him. He compiled it, so he put Samji your mudras and pranayam and the whole package. So they'll have that one package that they can always refer to. That's got everything they need for sleep. So if we add whatever we learn from you about the pranayam and the mudras tomorrow and add to Rameshi on Friday, then he'll put it together and that'll become the package for them to take, and they have it in the folder. So if they have a summary with those, they know exactly what they don't go back to all the notes. They have it all nicely put together. And that's kind of what we talk about, a visual, this is a guide for you, and another visual like that where you have images to then tell your subject. So I think what we do is one side will be this, the back side will be the data and the graphs. And then you've got like one laminated sheet with each disease. You keep them in your folder and you pull that sheet up and you've got everything you need.
Yeah, that'll be the ultimate. That's
we can develop that, and that'll take time.
I wasn't thinking that far, but that will be the ultimate.
I'll get in for that. Let's aim for that. I like it.
But I was just thinking about if we have, some of the data included in your presentation. Then each one of us can pull it out and put it in a way that we can explain.
Correct.
That's all I was thinking.
No, we'll do the hard work. We'll do the whole thing. Why not? It's a good idea.
Of course. Ultimately,
because then, I want to get you equipped with things, tools that will be very helpful for you.
That's
which you can do that. It's not difficult. Yeah. But yes, both. I totally agree. Both. Yeah. In fact, as the others already have plots, this is just a very difficult area because we have so much to cover in one. We had like 5 diseases to cover.
Absolutely. Yeah.
Okay, so I think the questions have been taken, and now the meditation session will start. So Shivani is giving meditation session. Shivani?
I'll start in 1 second.
You can open your video.
So everybody please sit with your legs crossed in a comfortable posture that you can sit steadily in for a long time. Put your hands in Gyan Mudra, facing upward, and place your right palm over your left palm. And close your eyes softly. We're going to start with Gayotsarg, relaxation. Keep your body steady and relax. Keep your body straight and stable like a statue without moving. And keep yourself completely steady. Breathe in and breathe out slowly. Tell your body to relax. Relax and relax. Feel that your entire body is gradually relaxing. We'll maintain this posture for exactly 5 minutes. Feel your whole body relaxing. Breathe in and breathe out slowly. Tell your body to relax. Now we will progress to Antaryatra. Concentrate your attention at the bottom of your spinal cord. Imagine there's a bright light that gradually travels up your spine to the top of your spinal cord. Imagine that the light rests at the top of your spinal cord and then gradually travels down. Now, breathe in and breathe out, and imagine the light going from top to bottom gradually again. And feel the subtle vibrations of energy that are traveling up and down. Completely focus your conscious mind inside your spinal cord. Synchronize your breath with the light moving up and down. For step 3, make your breath really slow and long. Inhale slowly and exhale slowly. Make your breath very rhythmic. Feel the vibrations of your breath in your navel. While you inhale, expand your abdominal muscles, and while you exhale, contract them. If you have thoughts that are coming in your mind, don't eliminate them, just observe them as an outsider. Imagine that your conscious mind shifts from your navel and travels to the junction of your nostrils. Imagine your nostrils with each inhalation and exhalation. Be aware of each breath. Now we will experiment with the perception of alternative nostril breathing. Make your breath very slow and long. Inhale through your right nostril and exhale through your left nostril. We will repeat this process by inhaling through our right nostril this time and exhaling through our left nostril. Let's repeat this process. Inhale through your left nostril and exhale through your right nostril. Inhale through your right nostril and exhale through your left nostril. If necessary, you can use fingers to guide this process if you're unable to do it without manual effort. Now we're going to perceive our body. Concentrate your consciousness at your left toe. Imagine there's a bright light at your left toe. Imagine the light travels through the rest of your toes, slowly, and then travels upward on your foot, circulating around your ankle. Imagine the light travels upward on your leg touching your knee, and then upwards all the way to your hip. Imagine the light circulates through your organs, your stomach, and gradually makes its way up to your shoulder. Now we will repeat this process for the right side of our body. Imagine the bright white light at our right toe. Breathe in, breathe out. Imagine that light circulating on the toes of your right leg and gradually making its way to the ankle, making a circle. The light gradually shifts upward, touching its knee, and then all the way to the hip. The light circulates through your organs and makes its way to your right shoulder. Breathe in, breathe out. Imagine the light is vibrating on your shoulders. Now we're going to perceive our right hand. Perceive your thumb, your fingers, and your wrist. Perceive the light making its way up on the right arm in light circles until it reaches the tip of your shoulder. Breathe in, breathe out. Now the light is on our left hand, circulating on our left thumb and gradually hopping on the fingers of our left hand. The light gradually shifts its way from the wrist to the elbow to the shoulder. Imagine with each second, there's a current flowing through your body, from the bottom to the top. Imagine your perspiration, the touch of your clothes. Be fully aware of your physical sensations at this moment. Slowly breathe in and exhale. Inhale and exhale. Now we will end the meditation. Bring your hands to the front and rub them, and cover your eyes. And open slowly. Thank you, and I hope this meditation session was relaxing.
Thank you, Shivani.
Thank you, Shivani. It was really good. It was relaxing.
Thank you, Shivani.
Yes.
So it was wonderful sessions by all. So now we will take next session. Narendra ji or Suril bhai, Pari. Anybody else? Tomorrow and day after tomorrow.
I can try tomorrow. I'm not fully prepared.